Hello, everyone. So today I want to continue my talk on AI and medicine. On this part 2 video, I'll be talking about what I think are roadblocks to AI replacing doctors and what I think would be good or bad about AI replacing doctors. Then at the end, I'll share a few words for students who may be interested in going to medical school, but who may be worried about this whole AI issue. I personally think there are still several major roadblocks to AI fully replacing human doctors. One such roadblock is the nature of the data itself in medical field. Now, I'm no computer scientist, but I imagine AI works by having learned from large amount of provided data. The problem in the medical data is that the patient data is very privacy sensitive. Legally, it is not easy to utilize this data. If you were ever involved in medical research, then you know that you have to jump through many hoops and fill out lots of paperwork just to be able to use the patient data. With increasing emphasis on privacy in our society, I'm unsure to what extent AI developers will be allowed to use patients' private information. On top of the privacy issue, medical data is often unclear and difficult to categorize. For example, let's imagine an unfortunate case where a patient is suffering from or battling cancer. Let's say that this patient developed infections such as pneumonia. While being treated for both pneumonia and cancer, the patient develops drug side effects. While being monitored at the hospital for these serious conditions, patient passes away due to heart failure. Now, such complex cases are unfortunately not uncommon at the hospitals. In such cases, how would one characterize the data? What is the main cause of patient's death? How could one determine how much each factor played a role? What's even more, there are also times when we simply don't know the answer or diagnosis. To complicate the matter further, there are some data or information that are too subjective in nature. One such example would be the common complaint of pain. There are patients who come to the hospital due to agonizing pain, and yet their test results are all normal or cannot determine the cause. On the flip side, there are those who pretend to be in pain in hopes of receiving pain medication. Now, how would AI be able to differentiate these if there are no tests to help it? Another major roadblock will be the legal issues, in my opinion. AI and computer systems are not without their errors and bugs. And without humans checking, resulting error, though may be rare, can have serious consequences in medical field. Would AI software company be willing to take on such heavy responsibility? Would the company that builds the hardware and robots? How about the hospitals that employ these software and hardware? In cases of cyber attack or hacking, what would happen and who would become responsible? I personally think that this issue of accountability may be the biggest roadblock to AI completely replacing doctors. Even if the technology becomes ready, human doctors may still linger for liability issue. On a side note, another thing also to consider is now how would people know that AI's care or AI's treatment is not ideal or even wrong altogether? Once AI replaces doctors, who would have enough medical education to know that AI's care was not optimal? There won't be a second opinion that could be obtained. How would people argue that AI was in the wrong? Beyond just the medicine, doctors often find themselves in moral, cultural, or ethical dilemmas. AI may have more medical knowledge than doctors, but it may not fully replace doctors until it can also handle this aspect of the job. There could be a situation, for example, where the patient does not wish to know their diagnosis, or where the patient's family or caretakers don't want the patient to know the diagnosis because they fear the patient may be devastated. There may be cases where child abuse is suspected, where the legal guardian of the patient cannot be trusted to make the medical decision for the patient. How would AI handle cases like this, where legally the guardian is indeed supposed to make the medical decision? How about case of domestic abuse? There are also instances where the patient may need more persuasion. Maybe the patient has a misunderstanding about their treatment, making him or her afraid to choose the most recommended treatment. Maybe the patient thinks the treatment is against their belief or culture and needs some explanation to clarify. Would AI be able to catch such nuances? If AI completely replaces doctors, what would medical care feel like for the patients? I think that the overall medical care has potential to become faster and more efficient. Patient may no longer have to wait hours. There also will be more universal standard of care. For those of you not currently in medical field, standard of care is not defined as getting the right answer or right treatment 100% of the time. It simply is meeting the expected level of care at the given situation. So one can imagine that standard of care may vary among different locations and practice settings. For example, standard of care at a small city with only one doctor in town will be very different from that of a big city with thousands of doctors. With AI, however, I think there will be more universal standard of care across the board. With AI, there may be less medical mistakes. Now, that doesn't mean that the patient will get 100% correct treatment all the time. I think there will still be diagnoses and treatment that even AI won't know the answers to. But at least the true mistakes would decrease, instances such as getting wrong medication to wrong patient. I think the overall medical care could become more affordable in general. I think the necessary care is likely going to become more affordable, but I wonder about less clear cases. Currently, there are exams that the patients can request their doctors to order for them, maybe out of fear from their personal or family experience. Most of the time, if the doctor orders them, insurances typically won't deny it. With AI, I'm not sure how the whole insurance system would evolve. For example, would insurance cover a test if the AI determines the test is valuable only in 1% of the time? Or would patients be responsible for paying for those tests on their own if it does not meet a certain percentage determined by AI? In some sense, maybe it would evolve to resemble socialized medicine. With human doctors fully replaced by I think there will be more responsibility on the patients as we discussed on part 1 video. It is true that medical decision is ultimately up to the patient even with human doctors right now. But with AI, patients would assume more burden in making sure that they understand the medical language and the associated implications, as ultimately patients themselves may be held responsible for their own medical decisions. From doctor's point of view, there will be a transition period where doctors' work will be made easier by AI. I don't know how long this period will be, but the easier my work becomes because of AI, the easier or closer it is for the AI to completely replacing me as a doctor. I can't speak for all medical fields, but if the hindrances I mentioned could somehow be overcome, I think theoretically it is possible for AI to replace a diagnostic radiologist. In that regard, I personally think AI has potential to replace non-surgical medical field doctors. I personally think surgical field may last longer than other non-surgical medical field in terms of being fully replaced by AI. For those who are in training or for students who are interested in going to medical field, I'll briefly share my 2 cents on this topic. We are still in early stages of AI, and so it is hard to predict how quickly AI will progress and impact the medical field. So I think it is too early to completely give up on becoming a doctor and change your career decision. But during your education and training, you certainly need to keep paying attention to AI applications in this field. If I had to guess, I personally think that you're likely okay if you're currently already in a residency or in medical school. With all the hindrances that I mentioned, I just cannot imagine AI completely replacing human doctors in the next few years. I think it would take at least a few years just to get to the point where AI is actually helping human doctors rather than just slowing us down. Then, if AI technology advances to a point where it can theoretically do all the work that a human doctor does, I think that it would still have to overcome the legal and political factors. So you certainly will have a few years of heads up warning of how things are changing in this field. So you should have enough time to be able to practice as human doctors as we do currently and be able to pay off your student loan and whatnot. Now, if you're currently in undergrad or in high school, I still think you may probably be still okay. But since you're looking at, approximately 10 years or more before finishing training and becoming a doctor, you should pay attention to this topic during school. 10 plus years of education and training is a long time, and AI may be having its impact quicker than we think. The good news again is that I think it's going to take multiple transitions rather than suddenly one day being replaced completely by AI. So along the way of your training, you still may have time to detect warning signs and adjust your course. If I were in your shoes, I would also be very open-minded about medical subspecialties. For example, if it turns out that surgical specialties really remain irreplaceable by AI, then I would consider becoming a surgeon even though it may not be my top choice of medical subspecialty, as long as I don't absolutely hate it. Also, if it were me, I would focus on trying to graduate and finish training as early as possible rather than taking years off in between schools because the field may change rapidly. All of this may sound very discouraging to those of you who are planning to become a doctor, but I don't want this to come to you as a surprise after you have made a huge time commitment. On the bright side, one, I do think there will be transition periods where you will have time to reconsider and readjust your career goals. Two, I also believe that there will be a sweet period where doctors' work will be made significantly easier by AI, which I personally am looking forward to. And who's to say that this sweet period won't last a long time? These are all just my speculations, however, and we will all see how this plays out in the future. That is all I have to say for today, and thank you for your time.